In this series, we'll be explaining the dental implant step by step, without fear, without any pressure, so that you can make the right decisions for your health and for the long term as well. Episode 1. What dental implants really are. Dental implants are not just artificial teeth, they are medical, ethically proven replacements for the missing roots. An implant sits right into the bone, not on the gums. It becomes part of your jaw over the time. That is why implants feel more closer, or I would say the closest to the natural teeth. Why do we need planning? Not every missing tooth needs implant, but every implant needs the right foundation. So it is high time to understand what is the actual need of where to put the implant, why to put the implant. That has to be done by a very experienced clinician. Episode 2. Who is a good candidate for dental implants? Age is not the only criteria to decide implants. Age does not matter actually, but your bone quality and the general health too. Diabetes, smoking and habits do matter, but up to an extent, and the clinician decides how much does they matter. So how long does the tooth has been missing is another factor that will decide the success. Some patients need bone support first because the bone is way too less, but some are ready immediately. Implants are not the rush decisions, but they are definitely the personalized decisions. Episode 3. Why scans are absolutely non-negotiable in implant. Implant planning starts normally a day before the surgery. Scan is something like an OPG scan, which is absolutely non-negotiable. It is the basis of starting the planning. CBCT scans, if needed, show the bone width, height, and the nerve position in a very exact manner. Eyes cannot see these details, and small X-rays miss the intricacies. X-rays just cannot suggest the small intricacies. Placing implants without the scan is blind work. Good planning avoids complication and protects your long-term success. Episode 4. Pain, fear and reality about implants. Most of the patients are too much worried about the pain that the implant surgery will cause because of the word surgery. But modern implant placement is controlled and precise. Local anesthesia keeps the procedure comfortable, and the keyhole surgeries has made it without any incision or the extended surgeries. Most patients say extraction was worse, but implant was more comfortable. Pain is normally a temporary thing. Function is a long-term thing. Fear does not decide your long-term experience. The new age technology does. Episode 5. Immediate versus delayed implants. Not all implants are placed the same day. Some are immediate, some need some healing time first, but immediate doesn't always mean that it is better. Delayed does not always mean that it is outdated. The decision about the bone, infection and the bite is the right way to decide. Shortcuts are sometimes risking the failure, but timing protects your results. Episode 6. Implant quality and longevity. All implants do not perform the same manner. Their material, design, surface, all these things matter. Cheap implants often cost more later because of the replacement and the other intricacies that are involved. Bone integration decides the longevity. The technique is the actual thing that decides the stability. Maintenance decides your lifespan. Implants can last decades if done and cared for in the right manner. Episode 7. Implants versus bridges. Bridges replace teeth, implant replace tooth. Bridges depend on the neighboring teeth and implants stand independently. Bridges may weaken your healthy teeth, implants protect them. The right choice depends on your mouth and definitely the right dentist that you have chosen. It is definitely not decided on the trends, what the trend is. Aftercare and responsibilities. Implants don't fail suddenly. They fail slowly if they are neglected. Oral hygiene is absolutely non-negotiable when it comes to implants. Regular follow-ups matter a lot. Smoking definitely affects your implant health, and so does your uncontrolled diabetes. Implant is a partnership between the dentist and the patient, and you just cannot ignore that partnership wherein both need to meet and do the follow-ups and do the hygiene assessment as well. Episode 9. The right way to decide on implants. Implant is not an emergency position. They are lifetime decisions. So, good dentists explain you all the risks, not just the benefits. Planning matters more than the promises. Questions are always welcome. That is how the implant should be planned. No pressure and all planning. That is all for the day. That ends up our implant education series as well.